Hello and welcome to my YouTube video titled The Pitfalls of Healthcare Reform. Before I go any further, I need to let you know where I stand. I believe healthcare reform is absolutely necessary, but I also know that it needs to be done right. If we don't get it right, we'll make healthcare affordability worse, not better. As it is, we already spend far more money on healthcare per person here than any other nation on earth. That top red line represents average healthcare spending in the U.S. today. After the next 5 nations, the rest of the world spends less than half as much as we do per person on healthcare. This despite the fact that millions of Americans lack insurance, some of them because they can't afford it. If these individuals have a single expensive illness or injury, it could wipe out their life savings. So there are 2 main problems that healthcare reform needs to solve. Better affordability of insurance so people can pay for their coverage, and access to care for those who because of their health status don't qualify for insurance today. Right now, there are 3 main health care plans designed to address these problems. One passed by the House of Representatives, another passed by the Senate, and recently the President has created a proposal to combine the first 2 and add some bipartisan features. Unfortunately, each plan has serious flaws. On March 8th of this year, the American Academy of Actuaries sent a letter to Speaker Nancy Pelosi and Majority Leader Harry Reid. This letter made some uncharacteristically strong statements about all 3 health reform proposals. In the letter, the Academy strongly reiterates the need to modify the legislation to avoid unintended consequences. They go on to say that there are major policy and detailed technical issues that have yet to be addressed. The politicians are urged to seriously reconsider certain issues already approved in the House and Senate bills. I don't know how much you know about actuaries, but these are some very strong statements for a group that isn't exactly known for being very political. Now, you need to remember who actuaries are. We are the men and women who use mathematical models to predict the future. We develop probabilities to figure out how likely it is that your house will burn down in the coming year, or if you'll die in the next 30 years, or if you'll live a long time and need to collect a pension. If you go out to the website for the American Academy of Actuaries, you can look up pictures of our board of directors. Now, I'm not suggesting that you judge a book by its cover, but the point I really want to make is, when actuaries make statements like, there are major policy issues, or we urge you to seriously reconsider, that's equivalent to normal people screaming from the mountaintops. This is meant to be a serious wake-up call. So now you're probably asking, just what is so wrong with the bills to get you actuaries all worked up? The first problem the Academy cites in their letter is the individual mandate. This is the part of the bill that would require everyone to have health insurance. If you don't have it today and you make a decent salary, you'll be fined if you don't buy coverage. But the Academy says the current provisions in the bills are too weak. Therefore, it won't be very effective, and then you'll have this nasty problem called adverse selection. What's adverse selection? That's a fancy actuarial term. All it means is that when rates go up fast, the first people who stop buying insurance are usually the healthy ones. And when they do, everybody else's rates have to go up. But this problem only happens if the healthy people stop paying for insurance. Why would they do that? Let's look at some scenarios. If you buy individual coverage directly from an insurance company rather than through an employer, then the cost of your insurance is largely dependent on your age and gender in most states. On this graph, I'm showing some numbers from a population of a few 100,000 insured people I pulled well over a year ago. The red line shows the average claims cost of adult women by age group, the blue line is adult men, and the yellow dot is the average claims cost for children. Notice that the women's line is a good bit higher than the men's during the childbearing years, but doesn't really take off until later on. Meanwhile, the men's line starts low but really ramps up in later years. Now, the healthcare bills would change all this and dictate that men and women pay the same rate. If insurance companies did this, then the rates paid by most women would come down, but the rates for men would go up. On top of this, the proposals wouldn't allow there to be so much difference in rate between the youngest people and the oldest. That would bring down the rates for folks in their 60s, but it would be an increase for people in their 20s. The proposals would also do away with risk rating. Risk rating means that insurance companies can charge different rates to people who are the same age, giving a better rate to the healthy people and a higher rate for the sicker people. In many states, this difference is plus or minus 30% or 35% from the standard rate. So if we do away with risk rating, the idea is that rates will come down for the sickest people, making insurance more affordable for them. But rates would go up for the healthiest people. So who gets hit the hardest by all these changes? The males in their 20s who are in good health. But just how much will their rates go up? Some of the actuaries at WellPoint, the largest health insurance company by membership, decided to tackle this very question. They looked at rates in each of the 14 states where they sell insurance. They considered how much rates would go up if they couldn't deny coverage, if they reduced the differences charged to different age groups, and if they did away with gender differences altogether, and if they had to discontinue discounts for healthy people. For each state, they looked at 3 different scenarios for people buying individual coverage directly from them rather than through an employer. One scenario was a healthy 25-year-old male. Another was a family of 4 in average health, where the husband and wife were both 40 years old. and the last was a less healthy couple, both age 60. Time and time again, the proposed legislation had the worst effects on the rates for the 25-year-old healthy male, but also usually raised rates for the family of 4. But let's focus for a minute on these 25-year-old males. Just how much are these men's rates expected to go up? In the state of Virginia, a 25-year-old healthy male can currently get one of WellPoint's $2,500 deductible plans for $66 a month. If WellPoint can no longer deny coverage to anyone, regardless of their health, this rate is expected to go up $33 a month if there isn't a strong mandate to make everyone buy coverage. On top of that, they would add $20 since men and women would now pay the same rate, and since 25-year-olds can't be too much lower than 60-year-olds. You add another $37 since being healthy doesn't get you a discount anymore, and then you add $12 for new taxes and other new rules. So that healthy 25-year-old male is now paying $168 a month instead of $66. That's $2,016 a year. And if the healthcare reform bills do pass, everybody who doesn't already have insurance would have to buy it. Now, to be fair, the bills do include a subsidy from the government for people who don't make enough money to afford this. That $2,000 would only be paid by individuals who earn at least 350% of the federal poverty level. For men making 300% of the poverty level, they would spend $1,980 a year. For those making 250%, they would pay $1,500 a year, and so on and so forth. But what kind of salary are we talking about when we say 350% of the poverty level, or 300% or 200%? According to the current guidelines, you would get no subsidy if your income was at least $38,000. Your rates drop down $3 a month if you make $32,500. You would pay $1,500 if you made a little over $27,000 a year, and folks making $22,000 a year would have to spend $924 a year on health insurance. And remember, if you're 25 years old and you have a job without insurance and you don't sign up for your own coverage, you're going to get hit with a fine. In the first year of the program, the Senate bill says you will pay a $95 fine if you don't buy coverage. So essentially, the Senate bill would say that as a healthy 25-year-old male, you would have two choices. Either pay this $95 fine, or, depending on your income, fork over $924 of your hard-earned income for health insurance, or $1,500, or $1,980, or $2,016. Now, think about the healthy 25-year-olds you know who are lucky enough to have a job, but they don't have health insurance. If I'm one of these guys, I know my chances are pretty good that I won't need to go to the doctor much next year, and even less that I'll have a heart attack. So if I have a choice between a $95 fine and paying $2,000 a year for insurance, pretty good chance I'll just pay the fine and take my chances. So now you see why all the actuaries are concerned that it's not an effective mandate. And what did the actuaries say would happen without an effective mandate? Adverse selection. Let's say the healthiest 80% of the insured population is shown here in green, while the least healthy 20% is shown in red. Actuaries and health experts often talk about the 80-20 rule. The 80-20 rule says that usually the least healthy 20% of the population usually accounts for about 80% of the total claims dollars. So the remaining 80% of the population, the healthier people, all their claims only account for 20% of the total dollars paid by the insurance company. So let's say now that healthcare reform causes rates to go up for all the healthiest people, and especially the youngest ones. And let's say that maybe 20% of the healthy people decide they don't need insurance anymore. So they cancel their insurance and just pay the $95 fine. Well, because these are the healthiest people, when they leave, not very many of the total claims dollars leave with them. That means all those remaining claims dollars on the right have to be split among a smaller population of remaining members shown on the left. In this example, adverse selection alone would add another 14% to everybody's rates, on top of their annual rate increases for things like health cost trends, deductible leveraging, and aging. You can find out all about these factors in another of my YouTube videos called The Truth About Rate Increases. But let's talk a little bit more about that mandate. Like I said, the fine would be $95 the first year if you don't buy coverage. The next year it jumps up to $350, and in the third year it's $750. So each year this mandate is expected to be more effective at forcing individuals to buy health coverage. But here's the problem. I talked about the state of Virginia in my example. An interesting thing happened in Virginia on March 10th. On that day, their General Assembly approved a bill making it illegal for the government to require individuals to buy health insurance. The Washington Post reported the next day that 34 other states are weighing similar legislation. So the mandate might be completely ineffective in over half the country. And if there's no strong mandate, then there will be tons of adverse selection, which means really high rate increases for everybody who does have insurance. I hope you found this video useful and informative. If you want to see more, you can visit my website at fixthehealthcarebill.com. You can also subscribe to my videos on YouTube, so you'll be notified anytime I post a new one. Thank you for your time watching today. And remember, my videos are not intended to stop healthcare reform, but to fix it. We need healthcare reform in this country so that all of us can afford good coverage when we get sick or injured, but we need to make wise decisions about how to make that happen. Thanks again, and have a great day.